are here to discuss a few questions that come into the mind of people who want to get rid of their contact lenses and glasses with ICL. ICL, what is ICL? It is the lens-based technique to remove glasses and contact lenses permanently. And I'm here to discuss with you the 10 most frequently asked questions that our patients have put to us. So one of the most common questions that are asked is, how many types of ICL or phakic IOLs are there in the market today? So we have a choice in India between the ICL, which is manufactured by the Star USA, which is imported to India from USA and Switzerland, and we use these very frequently, have been using it for the last 15 years. The other phakic IOLs that are also available in India are the phakic IOLs that are manufactured by our indigenous companies, and they also serve the purpose of what we call a phakic IOL. So people ask, is ICL a safe procedure? And yes, it is, because the ICL that we have been using has been manufactured by the Star ICL and for the last 25 years. So it has stood the test of time. And these are very compatible with the human eye. They don't cause any reaction, and their safety and track record is proven. The next question that is asked is, if I'm planning an ICL, how much time do I have to spend in your hospital? Well, the outcome of this procedure depends upon a very meticulous pre-operative workup. So the pre-operative workup is important so that the parameters determine the sizing of the ICL and which ICL we need to give. So these parameters take some time, and we do a cornea checkup, a retina checkup, and a refractive checkup to determine which ICL goes into a tailor-made fit into your eye. And this particular ICL is shipped from USA, and it takes approximately 2 weeks to come in, and it is a period of 2 weeks that we have to give so that we implant this particular ICL into your eye, which has been tailor-made to fit your eye. The surgical process itself is quite simple. We do not give any injections, and the whole process is done in 10 to 12 minutes. So the implantation of the eye, we take the patient into the operation theater because it has to be done under sterile conditions, and the lens is safely injected and inserted in the eye, and it goes behind where we called the pupil of the eye. It stays there and is there forever. This process is a very safe process. You go back home without a patch and you're seeing quite well next day itself. So in a day or two you can get back to your normal activities. However, the second ICL for the other eye is done usually after a week, and when the stability of the first ICL has been checked in the eye. So there is a time period of 5 to 7 days before the second IOL is placed inside the eye. Another frequently asked question is, will I be able to feel this EVO ICL inside my eye? Will it break? Will it cause any difficulty, irritation? Nothing at all. So it does not cause any difficulty. It stays in our body and it is there till we have to remove it for any particular condition. So that could be very old age, cataract, or if the doctor feels that it needs to be removed at any point of time in the future. As I said, it is a reversible procedure, and that's a big benefit. Will somebody be able to see the EVO ICL in my eye is another question that I'm asked. So really not, and it is nearly invisible to the eye. Yes, if someone or a doctor is looking through the microscope into the patient's eye at any point of time, and he's very appropriate in his technique, he might be able to discern that yes, there is an ICL that is placed. But even a casual examination by an eye doctor might not reveal that an ICL is there. Yes, the ICL is nearly invisible, and of course, somebody who is looking at you can never determine that an ICL is present in the eye without the aid of a microscope. So another frequently asked question is whether the ICL can at any point of time be rejected from the body. Not at all. This is a time-tested material of which the collamer is an integral part of the material of the ICL, and there are no chances of rejection. It is well accepted by every individual, by the body. So the ICL material that has, as I said, has stood the test of time for so many years. So many of my patients have another question, and that is, can this ICL be removed? Yes, the ICL can be removed at any point of time, and as I said, it was reversible as a procedure. So it's not like you put on a contact lens and remove the contact lens by yourself. It has to be done by a minor procedure, and only an experienced eye surgeon can do this procedure of removal of the ICL. But that is something that is done only as and when it is required. But the benefit and the beauty of this procedure is it is a reversible procedure. Our young patients have a very pertinent question. At times, their spectacles or contact lenses are a deterrent to the jobs for which they apply. And they usually ask us, can we apply for certain jobs that require us to be 6x6 in the eye? And yes, it is possible, and it depends upon the criteria. So you need to visit the website of that particular job that you're requiring to determine and understand whether this comes in the way of your job requirement. An ICL actually can correct the vision and you're free of your glasses and contact lenses. But of course, if it is for a job requirement, please look into the website and understand whether the ICL can be implanted and you can get through in your job. So that's a lot of questions. I hope we have been able to answer, but you might have a lot more. So do visit Trinetralaya at Kolkata, and we are there to help you and explain to you everything about ICL. You can also go to our website, and it gives a lot of detailed information. We also have reviews of our patients whom we have been operating on and the wow factor that they have experienced after ICL being done. It's all there in the website. Do visit our website as well. Thank you.